cancer has become a serious problem, and I think most people are beginning to recognize that chemotherapy and the traditional ways of treating people are really only adding a few months at the most to a person's life at the expense of all the downside. So people are in integrated medicine trying to find better ways to deal with the problem, and they recognize that the body has its own anti-cancer mechanisms, and that the reason why cancer has become a problem is because of the increasing amounts of toxins in the environment and as I said, the decreasing health of people. The immune system's becoming compromised because of toxins. So they recognize that the chemotherapy and the radiotherapy is only one part of the protocol, that people have become ill because of poor lifestyle, toxins in the environment, the fact that the natural healing capacity of the body is becoming compromised. So they recognize that you can't just use chemo and radiotherapy, that you actually have to support health. And that supporting health is probably as important as any other treatment. And if you use supporting health, you may be able to use less chemotherapy and less radiotherapy and cause less damage to the body from those particular approaches. So I think that it's just a natural process here of looking at what do we need to support health, not just how to treat disease. And I think that anything that supports health, and we know now what supports health. We know the natural mechanisms that need to come in. We know how to support liver detox. We know how to support heart. We know how to support cell membranes. We know how to support mitochondria. These are all processes in the body that need nutrients. The mitochondria, which produce energy in the body, can't function without coenzyme Q10, without L-carnitine, without D-ribose, without a range of nutrients in order to improve their functionality. So anything that is used to support health, giving the body tools to work with the cancer, will also mean that doctors who use chemotherapy and radiotherapy may be able to decrease the toxicity of that particular approach. And together, I think the kind of holistic approaches to treating cancer, my feeling is that it'll get better results than just treating in one way. Because before cancer develops, the body is dysfunctional for years and years. For years, 20 years, it's dysfunctional, then cancer appears.
Yes.
Well, if you just treat the cancer without improving the dysfunctionality of the body, you're removing the cancer, you're leaving the dysfunctionality behind. Doesn't make any sense. So the holistic approach is to, I'm not saying you shouldn't do anything to the cancer, remove it if you can. Even chemotherapy may be appropriate. But certainly there are other ways to support that dysfunctionality. And behind the dysfunctionality is lifestyle. Wrong foods, wrong exercise, poor sleep patterns. All that, toxins in the environment lead to dysfunctionality and end up with disease. If you treat the disease only without improving the functionality, it's like a mechanic that fixes the part that's broken but doesn't do a tune-up and doesn't speak to the driver. The right approach is to speak to the driver, to do a tune-up, and to fix the part that's broken. If you only fix the part that's broken, you're a bad mechanic. But that's what's happening in cancer treatment today. They're fixing the part that's broken. They're not doing a tune-up, which is improving the functionality of the body. They're not speaking to the driver about lifestyle management, because most doctors don't even know about lifestyle management. And that would be the holistic approach.